When you take care of patients who are seriously ill, and whether that's cancer or any number of conditions, it's kind of a high-stakes game for the patient and for the physician. We want to get it right. We want to accomplish what they want to accomplish, and those are not always easy to discern. The other thing is that patients aren't always prepared to think about this, and they're not always prepared to talk about it with their doctor. Sometimes they think, well, if I tell my doctor I'm worried about the end of my life, maybe he'll give up on me. No, we don't want to do that, and we're not going to do that. But by having conversations about what that might look like, we can understand where you want to go and how to get you there. And I found it very reassuring for patients to know that if they need a plan, that it's been made.
With advanced disease, we really can't apply a one-size-fits-all approach to treatment. We want to be sure that we're understanding what's important to them. If they have goals for how long they hope to live, if they have goals for a quality of life that they want to achieve, if they have goals for avoiding certain physical problems. We want to be sure that we're understanding all of this so that we're able to recommend and make treatment decisions that support these goals. Most people are coming into a cancer diagnosis and dealing with an illness of this sort for the first time, and this can be overwhelming. Most of our patients and families aren't sure where to turn for help. They're not sure what they should be doing, what they should be thinking about. Our goal is really to make these challenges a little more manageable by connecting them with resources and providing the services ourselves that assist them in coping with the stress, managing the daily challenges and needs that come along with these illnesses.
So with our Advanced Care Planning program, we actually kind of have two components. The General Advanced Care Planning program is open to all of our patients. We really encourage everyone to take part in it because it's important for everyone, healthy or with a cancer diagnosis, to have these conversations with their family should something unexpected occur. So we have these conversations with patients, we appoint an advocate, we fill out a directive, we do all of that good stuff. A second component of the Advanced Care Planning program is called the Advanced Stage Cancer Program. That program is designed for our patients who are receiving palliative chemotherapy. So they have a diagnosis where, unfortunately, we don't think we're going to be able to cure them, and it then becomes maybe even more important that we talk about what their wishes would be. So we talk with them about what their goals of treatment are, and also what kind of care they would want if they were to reach the end of their life or experienced a sudden complication. So we have those in-depth conversations with them and with their family member, make sure that they're all on the same page, and then we get those recorded in an Advanced Directive. If somebody asks why an advanced care planning or an advanced stage cancer program order has been put in for them, probably the best response is just to say, you know, this is something that Dr. So-and-so does for many of their patients. They feel that it's important for you. If the patient keeps pressing and wants some additional details, it's always appropriate to call the social worker. We'd be happy to come out and see them and just give them a little bit more detail. And if there's not a social worker available, certainly take down their name and their number, and we'll give them a call as soon as we're able to. So sometimes patients will ask, you know, why this program is important or why they need to take part in it. A good response to that is just to say this is something that your doctor feels is important to you and that they feel is important for many of their patients. We have many patients enrolled in this program. Again, if they're asking for more details, if they're really pressing for what this is going to entail, get a social worker. We're happy to come out and speak with them, or let them know that we'll give them a call if we're not available. So occasionally we have patients who are a little thrown off by the name Advanced Stage Cancer Program, and they might think it implies that they're dying or that they have a prognosis that's limited to a few months or something like that. If you have a patient who's asking about that, an appropriate response would be to say, you know, Dr. So-and-so refers a lot of his patients for this program. It's just something he feels would be helpful for you. If you do have questions regarding your prognosis or diagnosis, those are important things to take back to your doctor. And then if the patient keeps asking for more information, certainly get a social worker and we can come out and speak with them. Sometimes patients will be referred for the Advanced Care Planning Program or the Advanced Stage Cancer Program, and they'll say something like, I've already done an Advanced Directive, I did that with my lawyer, or I already have the document in place, whatever that might be. What we encourage patients, and what a good response for that would be, is to say, that's great that you've already done that. We would certainly like a copy of that for our records, and we would encourage you to bring it in. We also do value the conversation here, and we think it's important to have, and your doctor thinks it's important for you to have at this stage. So we would just encourage your participation, and this is something your doctor thinks is important for you. So if we are going to enroll a patient in the program, that is an activity that a staff member can select in ONCO. We've asked that our medical assistants go ahead and select that activity for any patient that they identify and that the doctor agrees is receiving palliative chemotherapy. So the order for that is called the Advanced Stage Cancer Program. They should select that activity in ONCO, and it will then be sent to our scheduling team. The scheduling team then needs to make one visit with Dr. Porter and then set up a separate visit with a social worker for the advanced care planning conversation. Prior to the advanced care planning conversation, a social worker will reach out to that patient, just ask if they have any questions, and also talk with them kind of about what to expect, what to bring, that type of thing. If another staff member observes a patient who is asking for the program specifically, or maybe mentions that they have an advanced directive that's old and they feel like they should update it, they can always put in an order themselves, and that order is called Advanced Care Planning. So if they put in that order, that person will get scheduled with a social worker, and we will help address all those needs. So if you're going to schedule the visit, you're going to either be selecting the Advanced Stage Cancer Program activity or the Advanced Care Planning activity in ONCO. The difference between the two is that the Advanced Stage Cancer Program activity is for people receiving palliative chemotherapy, who their doctor has agreed would be appropriate for. So we always want to clear that with the physician first. Advanced care planning would be for anyone who's receiving treatment with a curative intent. And so either activity would be selected in ONCO, our scheduling staff would set up the appointment, and then they would be seen by the social worker and or Dr. Porter as needed. If you need to see if advanced care planning has already been ordered for somebody, you can go in the chart and there's actually a category for advanced care planning. It's got its own category. So if you select that category and see any document in there that says Advanced Care Planning Note or Advanced Directive or Advanced Stage Cancer Program Note, that means the patient has already completed a visit, and so you don't need to put in an order for them. If somebody brings in an advanced directive, the best thing to do is to get it to a social worker. We want to review it, make sure it has the witness signatures, that it's properly signed, it's dated, it's got everything we need it to have. Once the social worker has reviewed it, they will then hand it on to the medical records team. The medical records team should upload the advanced directive into the advanced care planning activity with the document name Advanced Directive. The do not resuscitate order, if one of those comes in, should also be given to the social worker to look through and verify that it's legal and it has everything we require of it. The social worker will then stamp that approved, sign and initial it, and date it, and they will then give that to the medical records team. The medical records team needs to upload that into the DNR category. That can be found in ONCO using STAR DNR. It's the very first category you can select. The document name then is Do Not Resuscitate Order.